diabetes patient. Up next, we have Dr. Suha Alhebshi. Dr. Suha Alhebshi earned her PharmD degree from King Abdulaziz University. She also holds a master's degree from Al University in clinical toxicology, and she is a board-certified pharmacotherapy specialist. Dr. Suha has a tremendous interest in community awareness and service, which is showcased by publishing 2 books, one of them titled Common Mistakes in Using Medications. Currently, Dr. Alhebshi holds the position of inpatient pharmacy co-supervisor at King Abdulaziz University Hospital. Dr. Suha Alhebshi will inform us about a very challenging topic, which is the use of growth hormone. I believe we all have challenges as a pharmacist in the prescription of growth hormone and from one hospital to another. So please welcome Dr. Suha to the podium. Thank you.
Thank you, Dr. Abdul Hamid, for your introduction. Bismillah ar-Rahman ar-Rahim. Alhamdulillah wa salatu wa salam ala Rasulillah. First, welcome everybody to this presentation. I would like to thank all of you for your coming and staying here until this time. And I would like to thank Jeddah Pharmacy Conference for giving me this opportunity to give a talk with the title Update in Growth Hormone. So today, inshallah, I will talk about overview and use of growth hormone, then history of the previous attempts at generating long-acting growth hormone. After that, I will focus on the 2 medications that currently approved by Saudi FDA. Also, there are some factors should be considered by the physician when they selecting a patient on long-acting GH therapy. So we'll talk it about in details. And finally, I will talk about GH abuse in athletic people. The estimated prevalence of pediatric growth hormone deficiency ranges from approximately 1 to 4,000 to 1 to 10,000 in the general population, based on studies performed in the US, Europe, and Asia. But first, what's growth hormone? It's a protein hormone released from the anterior pituitary gland under the control of the hypothalamus. The role of growth hormone in children is to stimulate the secretion of somatomedin from the liver, which are a family of insulin-like growth factor hormones. So all of growth hormones plus somatomedins, in addition to thyroid hormone, all of these lead to linear increase in the children growth. Also, the role of growth hormone in adults is to stimulate protein synthesis in muscle and release of fatty acid from adipose tissue, which is called anabolic effect, and this is lead to increased muscle mass. Let's move to the clinical uses of GH. The most common use of GH, which is in growth hormone deficiency in adult and children. There are many causes of GH in deficiency in adults and children, either by congenital forms due to genes differences or structural anomalies of the pituitary, or acquired causes include central nervous system tumors, as well as CNS trauma, irradiation, infection, or inflammation. Also, Prader-Willi syndrome, one of the diseases that can be treated by growth hormone. It's Prader-Willi syndrome. It's a genetic disorder characterized by central obesity and reduced lean muscle mass and decreased ability to vomit and increased pain threshold. Another use of GH is in Turner syndrome, which is a gene disorder characterized by wide chest, low set ears, short and wide neck. SHOX gene haploinsufficiency. SHOX gene is responsible for the growth in children. So children with SHOX gene mutation often have scoliosis, like you can see in this picture, and hypertrophy of leg musculature, shortness of metacarpals, as you can see in the second picture, and microgythia. Microgythia, that means small jaw with descending chin. Last but not least, it's of using of growth hormone in Noonan syndrome. It's a gene disorder characterized by large head, broad nose, short neck of the baby. And I think all you know that chronic renal insufficiency in children is associated with dramatic changes in growth hormone and insulin-like growth factor axis, resulting in growth retardation. Okay, now let's move to our focus on the main use of GH, which is in growth hormone deficiency. It's also known as dwarfism or pituitary dwarfism. It's a condition caused by insufficient amount of growth hormone in the body. Let's move to the history of GH. First, in the daily GH therapy became available for treatment of pediatric GH deficiency was in 1985. Then in 1996, the adult hormone became available for treatment of GH deficiency. Then neutropin depot was the first long-acting hormone marketing and manufactured in 1999, but unfortunately in 2004 it's withdrawn from the market due to manufacturing and marketing issue. Then somapacitan is one of the long-acting that approved by Saudi FDA, and we will talk in this somapacitan in addition to somatrogon, which is also long-acting and growth hormone. We will focus on these two medications. Also, it's approved by Saudi FDA. Let's start it with the last one, somatrogon. It's manufactured by using recombinant DNA technology with 3 copies of CTP fused to human growth hormone. The glycosylation and CTP domains decrease renal clearance, and this is lead to make this somatrogon have long half-life and allows for weekly dosing. The indications that approved by Saudi FDA, it's indicated for treatment of children from 3 years of age and adolescent with growth disturbance due to insufficient secretion of growth hormone. The recommended dose is 0.66 milligram per kilogram body weight, administered once weekly, subcutaneous injection. And there are 2 forms or 2 strengths of somatrogon that approved. One pen is contained 24 milligram, and the other pen is contained 60 milligram, and both pens have 1.2 ml solution for injection. In case of missing dose, the main point is 3 days. If the patient missed the dose after the last missed dose, within 3 days after the last missed dose, administered as soon as possible, and then the usual once weekly dosing schedule should be resumed. But in case if 3 days have passed, then the last after the last missed dose, the missed dose should be skipped, and then the next dose administered on the regularly scheduled day. Regarding the storage, the pen should be stored in the refrigerator prior to use and between each use, and the pen should only be used up to 28 days after use and before the expiry date. One of the interesting studies that published in the journal Clinical Endocrinology and Metabolism in 2022, the title of the study was Efficacy and Safety of Weekly Somatrogon versus Daily Somatropin in Children with Growth Hormone Deficiency, a phase 3 study. This study was randomized, open label. No problem, I'll continue. This study was randomized, open-label, multi-center, 12-month parallel group study, compared the efficacy and safety of once-weekly somatrogon with once-daily growth hormone in treatment of naive patients with pediatric GH deficiency. A total of a total of 228 participants were randomized 1-to-1. One group takes somatrogon with a dose 0.66 milligram per kilogram as a once weekly, and the other group taking genotropin as a 0.24 milligram per kilogram per week as a once daily. And then they evaluated after the 12 months. And they study the efficacy and safety, which were the primary efficacy was annualized height velocity after 12 months of treatment, and they evaluated the main side effects. The conclusion of the study was at 12 months, once weekly somatrogon demonstrated non-inferiority in terms of annualized height velocity compared with daily genotropin. The treatment difference is 0.33 centimeter per year. As you can see in this picture, the patient with somatrogon, the height velocity of patient with somatrogon was 10.1, and the patients of genotropin have 9.78 centimeter per year. And also regarding the side effect or the safety, as you can see, the most of the side effects between two groups are comparable and similar to each other. Let's move to somabasitan or Sugroya. Sugroya or somabasitan is produced by recombinant DNA technology in E. coli, followed by attachment of albumin binding moiety. And this attachment of albumin binding moiety allows the medication to giving as once weekly. The therapeutic indications of somabasitan is indicated for growth hormone deficiency in pediatric in addition to the adult. The dose recommendation of pediatric with the growth hormone deficiency in naive patients and patients switching from other growth hormone products is 0.16 milligram per kilogram per week. And in adult GH deficiency, in naive patients and adults, the dose is 1.5 milligram per week. And in case of patients switching from daily GH product to somavacitan or once weekly, the dose is 2 milligram per week. The storage, it's like somatrogon, should be stored in ref, but should be used within 6 weeks, should not be freeze. And this is one of the important points, especially when patient counseling. If the patient asks you, if I'm traveling, how can I store somavacitan? So if refrigeration is not possible, somavacitan can be kept temporary at room temperature for a total of 3 days. If stored out refrigeration and then returned to refrigeration, the total combined time out should not exceed 3 days. This is a study published in the Journal of Clinical Endocrinology and Metabolism in 2022. The title of this study was Weekly Somavacitan is Effective and Well Tolerated in Children with GH Deficiency, the randomized phase 3 real 4 trial. This study was randomized, multinational, and open-labeled. 200 patients were from 86 sites across 20 countries. The primary objective was to evaluate the efficacy, safety, tolerability of once-weekly somavacitan compared with daily GH in treatment-naive children with GH deficiency. The primary endpoint was annualized height velocity by centimeter per year at week 52 after 1 year, and they found the estimated mean height velocity at week 52 was 11.2 and 11.6 centimeter per year for somavacitan and daily GH respectively. As you can see in this picture, somavacitan patients, the height velocity of them was 11.2, but in daily GH was 11.7. So they conclude that similar efficacy of somavacitan compared to daily GH was demonstrated over 52 weeks of treatment with comparable safety in treatment-naive children with GH deficiency. Let's talk about the prices. The first, somatrogon. As I said, they have 2 strengths available in Saudi Arabia and approved by Saudi FDA. The price of the pen with 24 milligram is around 795 Saudi Riyal. And the price of the pen with 60 milligram is around 1,987 Saudi Riyal. And regarding the somavacitan, they have also 2 strengths. The 5 milligram, the price of 5 milligram is around 1,024 Saudi Riyal, and the price of 10 milligram is around 2,048 Saudi Riyal. All these prices are taken from Saudi FDA website. As I said, there are some factors the physician they have to consider when they selecting which patients they have to treatment with long-acting growth hormone. So it's preferred with patients with poor adherence, for example, teenagers patient and children with needle phobia and patients on multiple other injectable medication. So it's easy for them to give long-acting growth hormone. On the other hand, it's not preferred with children with severe GH deficiency associated with hypoglycemia and cancer patients. We close to the end. GH abuse in athletic people. Many side effects are reported and health risk of using growth hormone in athletic people. These side effects including injection site reaction, increase in the brain, increase the pressure in the brain, retina damage, especially with patients with diabetes, hyperthyroidism, and pancreatitis. Also, long term, the use of growth hormone may cause the body to stop producing its own or down regulation, to down regulate the growth hormone pathways. Take home points. There are two medications approved by Saudi FDA, which are somatrogon and somavacitan. Somatrogon is indicated for growth hormone deficiency in pediatric from 3 years of age and adolescent, and somavacitan is indicated for growth hormone deficiency in pediatric in addition to the adult, and many side effects are reported of using of growth hormone in athletic people. These are my contact information. If you would like to ask any question regarding this topic, you are more than welcome. In addition, I will receive, inshallah, your question in the discussion. Thank you so much.